Welcome, beautiful mama. If you're 33 weeks pregnant and feeling a mix of excitement, fear, pressure, or even anxiety about labor, take a deep breath with me right now. You are safe. Your baby is safe. And everything happening in your body has a purpose. At this stage of pregnancy, it's completely normal to feel short of breath, heavier, and emotionally sensitive. Your body is doing incredible work, preparing both you and your baby for birth, even if it doesn't always feel comfortable. In today's video, I'm going to walk you through exactly what's happening with your baby at 33, why your body feels the way it does, what sensations are normal, and how to feel calmer and more confident as you approach labor. So if this content brings you comfort and clarity, please give this video a gentle like. It truly helps this channel reach more moms who need reassurance. And don't forget to subscribe, because here we talk about pregnancy week by week, with honesty, science, and a lot of love. You are not alone on this journey. Let's go through this week together. At 33 weeks pregnant, many women begin to feel that birth is no longer a distant idea, but a real and approaching moment. This realization can bring excitement, but it can also awaken fears, doubts, and insecurities, especially about labor pain, delivery, and whether the body will truly know what to do when the time comes. These feelings are not signs of weakness. They are part of the emotional transition into motherhood. Your body has been preparing for this moment since the very beginning of your pregnancy, even before you were aware of it. Every hormone release, every physical change, and every sensation you experience now has a biological purpose designed to support birth. Nothing is random, and nothing is happening without intention. When anxiety appears, it is often because the mind tries to anticipate the unknown. Labor feels frightening, mainly because it is unfamiliar, not because it is unsafe. Understanding what is happening inside your body helps replace fear with trust and curiosity. At this stage, reassurance is essential. You are not behind, you are not unprepared, and you are not failing. You are exactly where you need to be at the right moment, with a body that knows how to bring your baby into the world. As your pregnancy progresses into week 33, physical sensations often intensify. Shortness of breath, pressure in the abdomen, pelvic discomfort, and fatigue become more noticeable. These changes can feel overwhelming, but they are not signs that something is wrong. They are evidence that your baby is growing strong and healthy. Your baby is now larger and taking up more space, gently pressing against your organ. This pressure can make breathing feel shallow, especially when sitting or lying down. While uncomfortable, this sensation is temporary and will improve once your baby descends closer to birth. Inside your womb, your baby is not stretched out. Instead, your baby is curled into the fetal position, conserving space and staying protected. This position is nature's way of ensuring comfort and safety as your baby continues to grow. Knowing this can bring peace. Your discomfort has meaning. It reflects growth, preparation, and the final steps of pregnancy, not danger or failure. Emotionally, week 33 can feel intense. Hormonal fluctuation, physical exhaustion, and the anticipation of labor can heighten sensitivity. You may notice that small worries feel bigger, or that your thoughts return repeatedly to birth scenarios. These emotional shifts are not random. They are part of the mental and emotional preparation for labor and motherhood. Your brain is adapting, becoming more alert, protective, and aware as you approach delivery. It is normal to seek reassurance during this time. Listening to calm, informative guidance helps ground your thoughts and reminds you that millions of women have walked this path before you, successfully and safely. When you allow yourself to slow down, breathe deep, and receive information with compassion, anxiety softens. Confidence grows when fear is met with understanding. At this stage of pregnancy, your baby is completing crucial developmental processes. One of the most important is the continued accumulation of brown fat beneath the skin. This special type of fat helps regulate body temperature after. As this fat increases, your baby's skin becomes more pink and less translucent, resembling that of a newborn. This transformation is a sign of readiness and resilience. Brown fat allows your baby to stay warm after leaving the womb, especially in the first hours and days of life. It is one of the many ways your baby is preparing independently for the outside world. Knowing that your baby is gaining these protective features can bring comfort. Even before birth, your baby is adapting, learning, and preparing. Around 33 to 34 weeks, the volume of amniotic fluid inside the uterus reaches its maximum, approximately 1 liter. This increase contributes significantly to the feeling of heaviness and pressure in your abdomen. Amniotic fluid plays a vital role in cushioning your baby, allowing movement, and protecting against external pressure. It also supports lung development and temperature regulation. As the uterus expands with both fluid and baby weight, your center of gravity shifts. This can affect posture, balance, and comfort, especially when standing or walking for long periods. Although this stage can feel physically demanding, it signals that your pregnancy is entering its final chapter. Every sensation is part of the transition toward birth. Another reassuring milestone at 33 weeks is the development of your baby's digestive. By now, the intestines have activated digestive enzymes, making it possible for your baby to digest breast milk if born early. This readiness offers peace of mind. While full-term birth remains ideal, your baby has already achieved significant functional maturity. Breast milk is uniquely designed to meet your baby's needs, and your body will naturally adjust its composition based on your baby's stage of development. Understanding this can help ease fears about early delivery. Your baby is more prepared than you may realize. Your baby's bones are also developing rapidly. Most bones are now firm, providing structure and strength. However, the bones of the skull remain soft and flexible. These flexible areas, known as fontanelles, allow the skull to adapt during birth. This flexibility helps your baby pass safely through the birth canal and protects the brain. Fontanelles remain open well into early childhood, supporting ongoing brain growth. This is a natural and necessary feature, not a vulnerability. Caring for your baby's head after birth simply requires gentle awareness, not fear. Nature has designed this system with wisdom and precision. At this stage, many mothers begin to focus on their baby's position. Ideally, the baby will turn head down, preparing for birth. In first pregnancies, this often happens earlier, while in later pregnancy, it may occur closer to term. If your baby has not yet turned, it does not automatically mean there is a problem. Some babies take more time, and some positions can still change with guidance and patience. There are safe techniques that may help encourage optimal positioning, but these should always be done under professional supervision. Trusting the process while staying informed allows you to remain calm rather than fearful. As your baby descends into the pelvis, a process known as engagement or lightening, you may feel increased pelvic pressure. This can cause discomfort when walking, standing, or changing position. At the same time, many women experience relief in breathing and reduced heartburn. This shift occurs because the baby moves away from the diaphragm and stomach. These changes are signs that your body is transitioning into the final phase of pregnancy. They are signals of progress, not warning. Listening to your body and adjusting your movements can help you stay comfortable during this transition. Week 33 is a time to focus on preparation rather than fear. Continuing prenatal vitamin, staying hydrated, and resting when needed support both you and your baby. Preparing your hospital bag and familiarizing yourself with your birth environment can bring peace of mind. These small actions reduce stress and create a sense of readiness. Emotional preparation is just as important as physical preparation. Surround yourself with supportive information and calming voices. Above all, remember this: your body knows how to give birth. You are capable, supported, and closer than ever to meeting your baby. At 33 weeks pregnant, many women notice that breathing feels more difficult, especially when sitting, lying down, or talking for long periods. This sensation can be unsettling at first and may cause worry, but it is one of the most common and expected changes at this stage of pregnancy. Your baby has grown significantly and now occupies much more space inside your uterus. As a result, your internal organs are gently compressed, including the diaphragm, which plays a key role in breathing. This pressure does not mean that your baby is lacking oxygen or that your body is failing. On the contrary, it reflects healthy growth and a uterus that is doing its job by adapting to your baby's size. Understanding this helps transform discomfort into reassurance. What feels like limitation is actually progress. Inside your womb, your baby is not stretched out or pushing forcefully against your organ. Instead, Your baby remains curled in the fetal position, with arms and legs tucked close to the body. This position is natural and protective. It allows your baby to conserve space, maintain warmth, and remain comfortable as growth continues. Many mothers imagine their baby pressed or suffocated, but this is not the case. Your uterus expands gradually and adjusts to accommodate your baby's needs. Knowing how your baby is positioned can bring emotional relief and help you feel more connected rather than anxious. Shortness of breath at this stage is often more noticeable during moments of rest rather than activity. When lying down, the weight of the uterus presses upward, making breathing feel shallow. Changing position can help. Sitting more upright, sleeping on your side, or using pillows for support may improve comfort. This symptom usually fluctuates throughout the day. Some moments feel easier, while others feel more challenging, depending on your posture and your baby's movement. These sensations are temporary and will ease as your baby descends lower into the pelvis closer to labor. Emotionally, physical discomfort can amplify anxiety. When breathing feels restricted, it may trigger fear or a sense of losing control. It is important to pause and remind yourself that this sensation is expected and not harmful. Your body remains fully capable of supporting both you and your baby. Slow, mindful breathing can help calm the nervous system. Placing one hand on your chest and one on your belly can reconnect you with your breath. Reassurance comes from understanding that discomfort does not equal danger. As your baby continues to grow, the uterus reaches higher into the abdominal cavity. This upward movement explains why organs feel compressed. The stomach may feel crowded, contributing to heartburn or indigestion. The lungs may feel restricted, creating the sensation of breathlessness. These changes reflect the remarkable adaptability of your body. Each organ shifts position to support pregnancy. Rather than resisting these sensations, acknowledging them with patience can reduce stress and frustration. Your baby remains well oxygenated despite your breathing discomfort. Oxygen is delivered efficiently through the placenta, not through your lungs alone. Your body automatically prioritizes oxygen delivery to your baby, even when breathing feels different. This system is highly efficient and has supported countless pregnancies safely throughout history. Trusting this process allows you to relax and release unnecessary worry. As labor approaches and your baby begins to descend, pressure shifts downward. This change often brings relief to the diaphragm. Many women notice that breathing becomes even though pelvic pressure increases. This shift is a positive sign that your body is preparing for birth and that your baby is moving into position. Recognizing this pattern helps you anticipate changes with calm rather than fear. Each pregnancy experience is unique. Some women feel significant shortness of breath, while others notice it only occasionally. There is no right or wrong way to experience this stage. Your body responds based on your anatomy, posture, and baby's position. Comparing yourself to others can increase anxiety. Listening to your own body fosters trust and confidence. Your experience is valid and worthy of care. When discomfort arises, gentle movement can help. Walking slowly, stretching, or changing position encourages circulation and relief. Rest remains equally important. Giving yourself permission to slow down supports both physical and emotional well-being. Your energy levels may fluctuate, and that is okay. Pregnancy is demanding, and rest is productive. Caring for yourself now is part of caring for your baby. Shortness of breath at 33 weeks is a reminder that you are nearing the end of pregnancy. Each sensation marks progress toward meeting your baby. Rather than fearing these changes, view them as signs of preparation strength. Your body is adapting daily, responding intelligently to your baby's growth. You are not struggling, you are transitioning into one of life's most powerful moments. At 33 weeks pregnant, your baby is entering an important phase of physical refinement rather than rapid structural change. One of the most significant developments during this time is the continued growth of brown fat beneath your baby's skin. This type of fat is different from regular body fat. It serves a very specific and protective purpose, especially in the first days after birth. Brown fat helps your baby regulate body temperature once they leave the warm environment of the womb. This is crucial because newborns cannot yet control their temperature efficiently on their own. Knowing that your baby is developing this natural protection can bring comfort and confidence as birth approaches. As brown fat increases, you may notice that your baby's appearance on ultrasounds looks more filled out. The skin becomes less translucent and more pink, resembling the skin tone of a newborn. This change reflects maturity and readiness. Your baby is no longer fragile in the way they were earlier in pregnancy. These visual changes are signs that your baby is preparing for life outside the womb, adapting to a world with different temperatures and sensations. Each layer of fat is a layer of protection, warmth, and resilience. The accumulation of brown fat does not happen suddenly. It is a gradual process that accelerates in the third trimester. Your body supports this process through hormonal signals and nutrient delivery via the placenta. Every meal you eat and every moment of rest contributes to this development. This highlights how deeply connected you and your baby are. Your body works continuously, even when you are asleep, to support growth. Trusting this unseen work can help ease anxiety about whether you are doing enough. Many mothers worry about their baby's size or weight at this stage. It is important to remember that healthy development looks different for every baby. Brown fat development is not about size alone, but about function. Even babies who are smaller can be well prepared for birth if these systems are developing properly. Doctors monitor growth patterns, not just numbers. A steady trajectory is more important than a specific measurement. Releasing comparison allows you to focus on your unique pregnancy. After birth, brown fat plays a critical role during the first hours of life. When a newborn is exposed to cooler air, brown fat generates heat to maintain body temperature. This process reduces the risk of hypothermia and helps stabilize vital function. Your baby's body is already practicing this adaptation in preparation for the transition from womb to world. Nature anticipates this change and prepares your baby accordingly. The presence of brown fat is especially important in the early days when babies cannot shiver to generate warmth like adults. Instead, brown fat activates and produces heat internally, keeping your baby safe and stable. This process works quietly and efficiently, without conscious effort from your baby. Knowing this can bring reassurance that your baby has built-in systems designed for survival and comfort. As your baby's skin becomes more developed, it also becomes a better barrier against fluid loss and temperature. This maturation reduces sensitivity and supports overall stability after. These changes contribute to the familiar newborn appearance that many parents recognize. Your baby is becoming more recognizable as the little person you are about to meet. From a maternal perspective, it is natural to feel protective during this stage. Understanding your baby's internal preparation helps transform worry to trust. Rather than focusing on potential challenges, you can focus on the remarkable progress your baby has already made. This knowledge empowers you to approach birth with calm anticipation instead of fear. Information becomes a source of peace when it is grounded in biology and care. Your role during this time is not to control every outcome, but to support your body's natural process. Rest, balanced nutrition, hydration, and emotional calm all contribute indirectly to your baby's development. You do not need to be perfect. Consistency and care are enough. Your body and your baby are working together seamlessly. By 33 weeks, the growth of brown fat is a powerful sign that your baby is preparing for life beyond the womb. This stage marks readiness, resilience, and transition. Each day brings your baby closer to meeting you, equipped with natural protections designed by nature. You can move forward with confidence, knowing that your baby is growing stronger every day. At 33 weeks pregnant, many parents become curious or even concerned when they hear that their baby's skull bones are still soft and flexible. This information can sound alarming at first, especially when imagining labor and delivery. However, this flexibility is not a weakness or a risk. It is one of the most intelligent adaptations of human development, designed specifically to protect the baby during birth and beyond. The skull is made of several bones that have not yet fused together. These bones are connected by soft spaces called fontanelles. This design allows the baby's head to change shape safely during birth and then return to its natural form afterward. During labor, the baby must pass through the narrow space of the birth canal. A rigid skull would make this process more difficult and potentially dangerous. Because the skull bones are flexible, they can gently overlap and adjust as the baby moves through the pelvis. This natural molding reduces pressure on the brain and allows for a smoother passage during vaginal birth. Far from being fragile, this flexibility is a protective created by nature. After birth, the skull does not immediately harden. The fontanelles remain open to allow the brain to continue growing. The brain grows rapidly during infancy and early childhood. If the skull were fully fused at birth, this growth would be Instead, the skull expands gradually, accommodating the developing brain. This process continues well into early childhood, supporting healthy neurological development. Many parents worry about touching or caring for their baby's head because of the soft spots. While gentle care is important, there is no need for the fontanelles are protected by strong membranes and layers of tissue. Normal handling, holding, and washing are safe. Healthcare providers routinely examine these areas to monitor healthy growth and hydrate. Understanding this helps parents feel more confident and less anxious when caring for their new. The largest fontanelle, often called the soft spot, is located on the top of the baby's. This area gradually closes as the bones fuse over time. Most fontanelles close between 12 and 24 months of age, though complete skull fusion happens later. This timeline allows for optimal brain growth during the most critical developmental year. Patience is key, as this process unfolds naturally without intervention. In the womb, the flexibility of the skull also helps protect the baby from pressure and movement. As the baby shifts positions and responds to uterine contractions later in pregnancy, the skull adapts without injury. This adaptability is another layer of protection designed into fetal development. Your baby is supported and safeguarded in multiple ways, even before birth. It is common for babies born vaginally to have a slightly elongated or misshapen head at birth. This is temporary and normal. Within days or weeks, the skull naturally reshapes itself as the bones settle into place. This change does not affect brain development or intelligence in any way. Knowing this can prevent unnecessary worry during the early days after delivery. From a medical perspective, flexible skull bones are essential for both safe delivery and healthy development. Doctors and midwives are trained to assess head shape and fontanelle health during routine checkup. These assessments help ensure that growth is progressing normally. Regular monitoring provides reassurance and early detection of any rare concern. Emotionally, understanding your baby's anatomy can replace fear with trust. When you know why the body is designed a certain way, uncertainty fades. Education empowers you to approach birth with confidence rather than anxiety. Every aspect of your baby's development serves a purpose, even when it feels unfamiliar. Knowledge becomes a source of calm and reassurance. By 33 weeks, your baby's flexible skull bones are a sign of readiness, not fragility. They represent protection, adaptability, and ongoing growth. This design supports both a safer birth and a healthier future. You can move forward with peace of mind, knowing your baby's body is perfectly prepared for what comes next. Around 33 to 34 weeks of pregnancy, the amount of amniotic fluid inside your uterus reaches its maximum level. This increase often explains why your belly feels heavier, tighter, and more uncomfortable than before. Amniotic fluid surrounds your baby completely, creating a protective environment that supports growth and movement. It acts as a cushion, absorbing external pressure and reducing the impact of sudden movement. As the volume increases, your uterus expands even more, which can intensify sensations of pressure in the abdomen and pelvis. Although this stage can feel physically demanding, it is a sign that your pregnancy is progressing normally. Many mothers worry when they hear that there is a lot of fluid inside the womb. It is important to understand that this amount is intentional and carefully regulated by your body and your baby. Amniotic fluid allows your baby to move freely, stretch, and change position. These movements are essential for muscle tone and joint development. The fluid also helps maintain a stable temperature inside the uterus, keeping your baby warm and protected. Rather than being excessive, this fluid is perfectly balanced for your baby's needs at this stage. As the uterus becomes heavier with both baby and fluid, your posture may naturally. You may notice more lower back discomfort or difficulty standing for long periods. This shift in balance is normal and expected. Your body is adapting to support the increased weight safely. Gentle movement, rest breaks, and supportive footwear can help manage these changes. Listening to your body and adjusting your pace can prevent unnecessary strain. Amniotic fluid also plays a critical role in lung development. As your baby practices breathing movement, fluid enters and leaves the lungs, helping them. These breathing motions strengthen respiratory muscles and prepare your baby for breathing air after birth. Even though your baby is not breathing oxygen yet, these movements are an essential rehearsal for life outside the womb. Knowing this can bring reassurance that your baby is practicing important skills every day. At this stage, the combination of baby weight and fluid volume can increase pressure on the bladder. This often leads to more frequent urination. While inconvenient, this symptom is another sign that your body is adjusting to the final stages of pregnancy. Staying hydrated remains important, even if bathroom trips include. Adequate hydration supports both amniotic fluid balance and overall well-being. As pregnancy continues beyond this point, the volume of amniotic fluid may gradually decrease. This change happens naturally as your body prepares for labor. Your healthcare provider monitors fluid levels during prenatal visits to ensure everything remains within a healthy range. These checks are routine and designed to provide reassurance rather than cause concern. Trusting these assessments can help you stay calm and focused on preparation. Emotionally, feeling physically heavier can sometimes affect mood. Fatigue and discomfort may increase sensitivity or irritability. It is important to offer yourself compassion. Pregnancy places real demands on the body. Rest is not a sign of laziness. It is an essential part of supporting your baby. Honoring your limits helps preserve both physical and emotional energy. The growing weight inside your uterus is temporary. Every sensation you feel now is part of a transition toward birth. Your body is strong and capable, even when it feels tired. Each day brings you closer to meeting your baby, and each discomfort marks progress. Reframing heaviness as purpose can shift frustration into acceptance. As the uterus expands, gentle support from pillows, maternity belts, or sideline rest positions can improve comfort. Simple adjustments often make a significant difference in how you feel throughout the day. There is no need to endure discomfort in silence. Small changes can bring relief. Caring for yourself is an important part of caring for your baby. Reaching the maximum level of amniotic fluid is a milestone in pregnancy. It reflects protection, preparation, and balance. Your body is maintaining an environment that supports your baby in every possible way. Even when pregnancy feels heavy, it is moving forward exactly as it should. You can trust that your body knows how to carry you through this final stage. By 33 weeks of pregnancy, your baby has reached an important milestone. The digestive system is already capable of processing breast milk. This development brings reassurance, especially for parents who worry about the possibility of early birth. Inside your baby's intestines, digestive enzymes are now active. These enzymes are essential for breaking down nutrients and absorbing them. This means that if your baby were born at this stage, their body would already have the ability to digest milk safely. Understanding this readiness helps replace fear with confidence as you move closer to delivery. The digestive system develops gradually throughout pregnancy, and the third trimester is a time of refinement and maturation. By week 33, the intestines are practicing coordinated movements that will later help move milk through the digestive tract. These subtle motions prepare your baby for feeding, digestion, and nutrient absorption after birth. Even before your baby takes their first feeding, their body is rehearsing this vital function. Breast milk is uniquely suited to meet your baby's needs at every stage of development. If your baby arrives earlier than expected, your body naturally adjusts the composition of milk. This adaptability ensures that your baby receives the right balance of nutrients, antibodies, and enzymes. Your body and your baby remain deeply connected, responding to each other's needs instinctively. This connection offers reassurance that nourishment will be available when your baby needs. Many mothers worry about whether their baby will be strong enough to feed after birth. It is important to remember that feeding is a learned process for both mother and baby. Digestive readiness does not mean perfection, but it does mean capability. With guidance, patience, and support, most babies gradually learn to effectively. Trusting this learning process helps ease unnecessary pressure on yourself. The fact that your baby's digestive system is functioning reflects overall maturity. Systems in the body do not develop in isolation. As digestion matures, other systems such as the immune and nervous systems are also progressing. This coordinated development increases your baby's resilience and ability to adapt after birth. Your baby is becoming more prepared each day, even when you cannot see it. If birth were to happen earlier, healthcare teams are well equipped to support feeding and digestion. Modern neonatal care works alongside your baby's natural ability, not against them. Knowing that support exists can help reduce anxiety about unexpected scenarios. Preparation does not mean expecting problems. It means feeling secure regardless of outcome. Emotionally, understanding your baby's readiness can bring a sense of relief. Fear often comes from imagining the unknown. When you replace uncertainty with knowledge, confidence grows. This calm state benefits both you and your baby, supporting emotional balance during pregnancy. Peace of mind is a powerful form of preparation. Your role during this stage is to continue supporting your body with rest, hydration, and nourishment. Every healthy habit contributes indirectly to your baby's development. There is no need for drastic changes or perfection. Consistency is enough. Your body knows how to prioritize your baby's needs. As delivery approaches, focusing on what is already developed helps counter anxious thoughts. Rather than asking what if something goes wrong, you can remind yourself of what is already working well. Your baby has reached significant milestones that support life outside the womb. These achievements deserve recognition and trust. By 33 weeks, digestive readiness is a sign of strength, not vulnerability. It reflects the remarkable progress your baby has made throughout pregnancy. Each day brings additional refinement, confidence, and capability. You can move forward with reassurance, knowing your baby is more prepared than you may realize. At 33 weeks pregnant, many mothers begin paying closer attention to their baby's position inside the womb. This awareness often brings question, curiosity, and sometimes worry about whether the baby is in the right position for birth. The most common and ideal position for labor is head down, also called the cephalic position. In this position, the baby's head is oriented toward the birth canal, preparing for delivery. However, it is important to remember that babies are still active at this stage and may continue to move and adjust their position. A baby's current position is information, not a verdict. In first pregnancy, babies often settle into the head-down position earlier. In second or third pregnancy, there may be more space in the uterus, allowing babies to turn later. This variation is completely normal and does not indicate a problem. Every uterus, every baby, and every pregnancy follows its own timeline. Comparing timelines can create unnecessary anxiety, while understanding variability fosters calm. Some babies may be in a breech or seated position at 33 weeks. While this can sound concerning, it does not always mean the baby will remain that way until birth. Many babies naturally turn head down between 34 and 36 weeks. Your baby responds to space, gravity, and uterine shape, often changing position without intervention. Patience is often the most effective approach during this phase. There are gentle techniques that may encourage a baby to turn into the optimal. These techniques focus on posture, movement, and gravity. However, it is essential that any method used is guided by a healthcare professional with experience. Not all techniques are appropriate for every pregnancy, and safety must always come first. Professional guidance ensures that both mother and baby remain protected. In some situations, a medical procedure known as an external version may be considered to help turn the baby. This maneuver must be performed by a trained and experienced physician in a controlled environment. While it can be effective, It also carries risks and is not suitable for everyone. Informed decision-making and medical supervision are crucial. If a baby remains in a breech or transverse position closer to delivery, healthcare providers will discuss the safest birth option. In some cases, vaginal birth may still be possible with experienced professionals. In others, a cesarean birth may be recommended. These recommendations are based on safety, not failure. The goal is always the well-being of both mother and baby. Emotionally, uncertainty about baby position can feel stressful. It is natural to want clarity and reassurance. Understanding that there are safe options for every scenario helps reduce fear. Flexibility and trust allow you to adapt without feeling out of control. Birth does not follow a single script, and that is okay. Your body and your baby are communicating constantly. Movements, pressure, and sensations often reflect these adjustments. Paying attention without overanalyzing helps you stay connected without becoming overwhelmed. Your healthcare team is there to interpret what matters. You do not have to carry these questions. Preparing mentally for different possibilities can be empowering. Rather than focusing on what might go wrong, focus on how supported you are. Knowledge, preparation, and professional care create safety. Confidence grows when you know that solution. You are not unprepared. You are informed. At 33 weeks, baby position is part of an ongoing process, not a final outcome. There is still time, movement, and possibility ahead. Trust your body, trust your baby, and trust the support around you. You are moving forward with strength and awareness toward birth. As your pregnancy approaches the later weeks, your baby will gradually begin to descend into the pelvis, a process often called engagement or lightening. This moment marks an important transition as your body prepares for labor. When the baby moves lower, many women notice a change in how their body feels. Pressure shifts downward, and sensations in the pelvis may increase. This descent is not sudden or aggressive. It happens gradually as your body and baby work together. Understanding this process helps replace surprise with calm anticipation. One of the first noticeable changes when the baby descends is increased pressure in the pelvic region. You may feel heaviness or discomfort near the lower abdomen. This sensation can be unfamiliar, especially in first pregnancy. However, it is a sign that your baby is positioning for birth. The pelvis is designed to support this process, even when it feels uncomfortable. Listening to your body during this time is key to managing sensation. At the same time that pelvic pressure increases, many women experience relief in breathing. This happens because the baby moves away from the diaphragm. With less pressure on the lungs, breathing often feels deeper and easier. This contrast between pelvic pressure and breathing relief can feel surprising but is very common. It is a positive sign that your body is making space where it is needed. Heartburn and indigestion may also improve as the baby descends. The stomach experiences less compression. This relief can make eating and resting more comfortable. While not every symptom disappears completely, many women notice meaningful improvement. These changes reflect the shifting balance inside your body. Emotionally, the sensation of the baby descending can trigger mixed feelings. Some women feel excitement, while others feel increased awareness of the approaching birth. Both responses are valid and natural. Allowing yourself to feel without judgment helps maintain emotional balance. Preparation involves both physical and emotional readiness. Each woman experiences engagement differently. Some feel clear changes, while others notice subtle shifts, or none at all. There is no universal timeline or sensation that defines this process. Trusting your own experience rather than comparing it to others helps reduce unnecessary worry. Your body communicates in its own way. As pelvic pressure increases, daily movements may feel more challenging. Walking, turning in bed, or standing up may require more effort. Taking movements slowly and mindfully can reduce discomfort. Supportive footwear and gentle stretching may also help. Small adjustments can make a big difference in comfort. Despite the physical sensations, engagement is a sign of progress and readiness. Your baby is aligning with your body's natural design for birth. This coordination reflects trust between your body and your baby. You are not forcing this process. It is unfolding naturally. Mentally reframing pelvic pressure as purpose rather than pain can change how you experience it. Each sensation marks a step closer to meeting your baby. Focusing on the meaning behind the discomfort helps reduce fear. Awareness brings empowerment. As your baby descends, remember that your body is doing exactly what it needs to do. Relief in breathing, changes in digestion, and pelvic pressure all signal preparation. These sensations are part of the transition, not a warning. You are moving confidently toward birth, one step at a time. As you approach the final weeks of pregnancy, your body begins to send clearer signals that labor is getting closer. Recognizing these signs can help you respond calmly instead of with fear. Many women worry that they might miss the signs or misunderstand what their body is telling them. This uncertainty is common and completely. Learning what to expect gives you confidence and helps you feel prepared rather than anxious. Knowledge turns uncertainty into reassurance. One of the most well-known signs of approaching labor is the presence of contractions that become regular and consistent over time. Unlike occasional tightening or practice contraction, true labor contractions follow a pattern and gradually increase in intensity. They do not disappear with rest, hydration, or changes in position. Understanding this difference helps prevent unnecessary panic. Lower back pain or persistent aching in the lumbar region can also indicate that labor is approaching. This pain may feel deep and steady, sometimes wrapping around to the lower abdomen. Unlike muscle soreness, it often does not improve with rest. Recognizing this sensation allows you to respond with awareness instead of pelvic pressure and pain in the hip or pubic bone area may increase as the baby continues to descend. This pressure can make certain movements uncomfortable, especially turning in bed or standing up. While uncomfortable, this sensation reflects alignment and preparation. Your body is making room for birth. Another possible sign of approaching labor is the release of the mucus plug, a thick discharge that may be clear, pink, or slightly blood-tinged. This occurs as the cervix begins to soften and open. Not everyone notices this sign, and its timing varies widely. Its presence is informative, not alarming. The rupture of membranes, often referred to as the water breaking, is another sign many women expect. However, it is important to know that labor often begins without this happening first. In many cases, contractions start before the membranes rupture. Understanding this prevents confusion and unnecessary worry. Not all signs appear at once, and not all women experience the same. Labor unfolds differently for each person, and there is no single correct path. Your experience will follow its own rhythm. Trusting this variability helps maintain emotional. Recognizing labor signs can bring a mix of excitement and nervousness. Both feelings are valid and expected as a major life event approaches. Allowing yourself to acknowledge these emotions without judgment can reduce. Emotional awareness supports physical readiness. Having a plan in place, knowing when to call your healthcare provider and when to go to the hospital can ease anxiety. Preparation provides structure and confidence. You do not need to memorize every detail, just the key steps. Support is always within. Understanding the signs of approaching labor empowers you to respond with trust instead of fear. Your body communicates clearly when it is time. Each signal is part of a natural process guiding you toward birth. You are capable of recognizing and responding to what your body needs. At 33 weeks pregnant, preparation becomes a source of calm rather than anxiety. Small, intentional actions help you feel grounded and supported as birth approaches. Continuing your prenatal vitamins is one of the simplest and most important ways to care for both yourself and your baby during this. These vitamins support blood volume, bone health, and energy level, all of which are especially important in the third trimester. Consistency matters more than perfection, and each day of care adds up. Hydration and nourishment also play a key role in how your body feels. Drinking enough water helps support circulation, digestion, and amniotic fluid balance. Eating regular, balanced meals can stabilize energy levels and reduce discomfort. There is no need for drastic dietary change. Gentle attention is enough. Your body knows how to use what you give it wisely. Preparing your maternity bag is another practical step that brings peace of mind. Having essentials ready reduces stress if labor begins unexpectedly. Packing does not mean labor is imminent. It simply means you are prepared. Knowing that everything is ready allows your mind to relax. Preparation creates emotional safety. Familiarizing yourself with your birth environment can also reduce anxiety. Visiting the hospital or birthing center helps replace fear of the unknown with familiarity. Understanding where you will go and who will support you builds confidence. This familiarity helps your nervous system stay calm during labor. Calm supports progress. Emotional preparation is just as important as physical preparation. Pregnancy is not only a physical journey, but a deeply emotional one. Taking time to acknowledge your feelings allows them to soften rather than build up. Fear often decreases when it is met with understanding. You are allowed to feel everything you feel. Support from a partner, family member, or trusted companion makes a meaningful difference. Sharing your thoughts and expectations creates connection. You do not need to be strong alone. Birth is a shared experience, supported by others who care about you. Allowing help is a form of strength. As you approach the final weeks, your body is quietly rehearsing for labor. Hormones, muscles, and rhythms are aligning naturally. Much of this preparation happens without conscious effort. Your role is not to control the process, but to trust it. Your body has been preparing for this moment all along. Mentally shifting from fear to trust takes practice. Gentle reminders help reframe your thoughts. Instead of asking, "Will I manage?" you can ask, "How can I support myself right now?" Each calm thought supports your nervous system. Calm creates space for confidence. Every pregnancy journey is, and there is no single right way to feel at 33. Some days feel heavy, others feel peaceful, and many feel like a mix of both. All of these experiences are valid. You are exactly where you need to be. As you move forward, remember that you are capable, supported, and prepared. Your body knows how to give birth, and your baby knows how to be born. Each step brings you closer to meeting your baby. You are not alone. You are ready.